Good morning, everyone. Today I'll be talking on patient awareness on gouty arthritis. So, gout is basically known as Richman's disease or the disease of the kings. The primary cause of gout is overindulgence of meat, seafood, and alcohol, a diet which is only the affluent could afford. Despite the debilitating pain, gout was considered a status symbol because of its associations with its wealth. So the risk factors for gout are basically I've told in the previous slide, consuming alcohol, consuming red meat, which will cause gout, and the gout will because of the increase in the uric acid, there will be deposition of the urate crystals. The urate crystals are most commonly deposited in the first metatarsophalangeal joint, which is the big toe, which has been depicted in the picture. And after the chronic repeated attacks of these repeated attacks of hyperuricemia and gout, we'll be seeing this gouty tophi, which are depicted in the image. So, what causes the gout? So, basically, uric acid is produced as part of body's metabolism of purines. Body breaks down any purine containing substances such as nucleic acid from our diet or from the breakdown of our own cells. The normal levels of uric acid in our body are 3.6 milligrams per deciliter to 8.3 milligrams per deciliter. So when there is high levels of uric acid in the blood, it leads to deposition of the uric acid in the joints, which leads to gout. So who gets gout? Basically, the persons who has higher levels of uric acid and who are not able to excrete the uric acid products. Uric acid is usually generated, as I've explained previously, as a product of purine metabolism. When they are not filtered by the kidneys or if there is increased production of the uric acid in the body, then it leads to gout. And inability to excrete enough in the urine leads to gout, and foods which leads to overproduction of the uric acid are red meat and beer, which will contain higher levels of purines. Basically, it is seen more commonly in the males, which is in the ratio of 9, and compared to the females, which is seen about 9:1 ratio. The age group of the presentation of gout is mean age group is 40 to 60 years of age. What does a gout attack look like and how the patients feel like? I'll be explaining the symptoms. So basically, the patient who has a gout attack will have the joint which is involved will be extremely painful, which is associated with the warmth, redness, and swelling of the involved joint. Some joints that have been easily visible can be if he's having a chronic attacks of gout, we can see the deposits of the uric acid known as tophi. Most gout sufferers will request specific treatment for their painful condition because it is the worst pain he experiences when he gets the gout attack. Risk factors for gout. Some people will be having a positive family history that gout is been running in their families, and being overweight is one of the risk factor. And gender and age, it is 4 times more common in man. And certain medications like using diuretics, beta blockers, and AC inhibitors are also associated with the development of gouty arthritis. Other conditions, rather than where we see this gout or hyperuricemia, is the patients with CKD, dyslipidemias, higher blood pressure, and type 2 diabetes mellitus. So symptoms of gout I've depicted in the picture clearly. There will be sudden severe joint pain in the involved joint associated with the swelling of the involved joint stiffness in that particular joint, and patient may also experience mild fever. So basically, gout is an inflammatory disease. The gouty attack will be is due to the monosodium urate crystals, which are deposited in the first MTP joint, and the joint appears red, hot, tender, and swollen. So these are the main symptoms of gout. Uh, so if the gout is untreated, it can lead to permanent damage to the joints. So myths regarding gout: 6 in 10 falsely believe that gout only affects the feet or toes, and 1 in 2 don't know that gout can affect both men and women, and 6 in 10 don't know that gout is a form of arthritis. And dietary modifications in patients with gouty arthritis. The substances to be avoided in the patients with gouty arthritis are the substances which contain increase in the purine, such as organ meats, red meat, seafood, such as mussels, shrimps, lobsters, and high fructose corn soups, sweet fruit juices, and processed snacks and excess sugars. These are the things which are to be avoided in the patients. The recommended diet in the patients with gouty arthritis is fruits and vegetables, low-fat diets, lean red meat, poultry, legumes, and whole grains. These are the dietary modifications in patients with gouty arthritis. So long-term impact of gout, untreated gout can lead to other serious medical conditions such as hypertension, stroke, diabetes, and it was been shown in various studies that hyperuricemia is associated with metabolic syndrome and cardiovascular risk. How can an attack of gout be treated? Initially, the acute attack of gout is very different from the prevention of subsequent attacks. So the treatment usually includes usage of non-steroid and anti-inflammatory drugs, corticosteroids, and colchicine and local steroid injections. So the treatments which are used for prevention, such as allopurinol, can actually make things worse in an acute attack. So acute attack will be usually treating with NSAIDs, corticosteroids, colchicine, and local steroid injections. Then, how can a gout attack can be prevented? The further, how can the further attacks of gout be prevented? So diet plays a key role in it. The limited red meat usage, limited shellfish usage, limited alcohol usage, especially beer, and losing weight will help in preventing other attacks of gout. And the medications which will prevent the further attacks of gout are colchicine, allopurinol, and febuxostat, probenecid, and lesinuride. These are the medications which are used in prevention of further gouty attacks. Next, the common differential thing we have to differentiate is between gout versus rheumatoid arthritis. So gout is usually involves your one side of the body. The pain typically starts in one big toe, and we can see the uric acid crystals which will deposit and causes tophi, and there'll be fever and flare-ups usually occurs at night with remission-free periods will be there. Whereas rheumatoid arthritis, it involves the bilateral side of the body, and pain typically occurs in the morning with early morning stiffness. And in rheumatoid arthritis, we can see that if we do the activity, the symptoms will gradually decrease over time, and there'll be fatigue in patients with rheumatoid arthritis. So how is the gout diagnosis? So usually once the patient presents with gout, the inflammation reaches a maximum within 1 day, and he'll be having a history of similar episodes of inflammation in the past, and attack of arthritis in a single joint, redness over an involved joint, involvement of the base of the big toe on one side, uric acid elevation on blood testing, and joint fluid is tested for infection and is negative. X-ray shows cysts in bone and erosions. Progression of gout, we can see that first, because of the increase in the uric acid, initially there may be no symptoms, but after that, patient has, you can see in the red, which I've depicted, that if the patient has first acute flare, followed by the acute flare in gout, there will be a remission-free period, which is intercritical periods of gout. And between the episodes of gout, there may be intercritical periods, which are free, and as the time passes, the intercritical periods, that is the symptom free periods, will be getting shorter, and he'll be getting an advanced gout. Stage 1 of gout with basically I'll be explaining the stages of gout. Stage 1 is high uric acid, where there is elevated uric acid without gout or kidney stone, with no symptoms and not being treated. And stage 2 is acute flares, where the patient will be having acute gout attacks causing pain and inflammation in one or more joints. And stage 3 is intercritical periods, the time between acute attacks during which a person feels normal but is at risk for recurrence of acute attacks. And stage 4 is advanced gout, where there will be chronic gouty arthritis, in which there will be lumps of uric acid or tophi. uh, like may, can the patient with gout he can walk? Should the patient with gout can be walking? Yes, it is true. The patient with gout can walk. Exercise is of great help for losing the weight. And when there is a gouty flare, we give the gouty joint a rest, treat the gout flare quickly, and the flare after treating the gouty flare, the flare will be shown. Thank you.